This is Beijing Capital International Airport. From Sunday, inbound travelers will no longer have to undergo quarantine or take nucleic acid tests upon arrival here or at other gateways across China. Back in March of 2020, almost 3 years ago, the Beijing tightened the quarantine measures for inbound travelers as the COVID-19 pandemic worsened overseas. The policy continued until now as China officially downgraded management of the disease on Sunday from Class A to B. It's revising the terms used, switching from novel coronavirus pneumonia to novel coronavirus infection. The main changes include dropping mass nucleic acid testing. Asymptomatic and mild cases will also now be managed at home. And the epidemic prevention and control will focus on key locations, institutions, and vulnerable groups of people, especially the elderly who are hit hard during outbreaks. Officials said the change came after the comprehensive assessment of domestic and international dynamics, mainly based on 3 factors.
First, the transmissibility and immune evasion of the pathogen. Second, the immune status of general public, treatment capacity of health institutions, and third is the intensity of our public intervention measures and how well they are received by the general public.
On Saturday, China released the 10th COVID-19 prevention and control protocol, outlining regular disease surveillance requirements and ramped-up measures to counter an emergency and protect vulnerable groups. Hospitals' costs for COVID-19 patients will continue to be fully reimbursed until the end of March. As of Thursday, China has about 216,000 intensive care beds, up from 138,000 on December 9, and their occupancy rate stands at around 80% at present. As the rise of infections on the mainland has stoked concerns over the emergence of new variants, experts said China has set up the multiple systems and databases to enhance monitoring and share information.
By far, all new variants found in China are those that had already been reported to the international sharing platform, which means that they've already spread in the world. We are monitoring whether new variants would appear in China, and if so, we'll timely report that to the international community.
With many cities like Beijing bustling again, experts believe that outbreaks in many urban and rural areas have peaked, and localities are closely monitoring the virus and other respiratory diseases, especially during the Spring Festival travel rush. Zheng Yibing, CGTN, Beijing.